Hi. So today we're gonna be talking about the pericardium. Our previous class we talked about mediastinum, in which we said that it has different parts, superior and inferior. So today we'll be talking about pericardium. Okay, so you can see pericardium. Pericardium, it's simply a double-walled fibrous sac that contains the heart and its great vessels that is located within the middle mediastinum. Yes, that is bounded in front by the posterior part of the sternum, body of the sternum, and posteriorly by the anterior part of the T5 to T8 vertebrae. Okay, with that being said, you can say that their function, number one, it can limit the movement of the heart. Number two, prevent excessive cardiac distension. Number three, it can be serving as a lubricating container in which its contents might as well help to lubricate the heart. What is it called? Helping it to move in order without one part touching the other. Okay, then the location, where can we find our pericardium? The pericardium can be found within the middle mediastinum, at the back of the sternum, body of the sternum, and in front of what? The thoracic vertebrae. Number 5 to what? Number 8. That is just it. Then divisions. Embryologically speaking, the pericardium is divided into 3, in which we have the fibrous pericardium, the viscera, and the periater. For gross anatomy's sake, we'll be saying that we have 2 divisions of this pericardium, which are, number 1, talk about the fibrous pericardium. Number 2, talk about the serous pericardium. For the fibrous pericardium itself is the part that lines the heart externally. It is connected to each other by what we refer to as, sternopericardial ligament. Forget about the ligament. It is just the one that connects the pericardium to the sternum. Okay, then the fibrous pericardium, inferiorly, it is connected to what we refer to as the central tendon of the diaphragm. Diaphragm, which is the principal muscle for respiration. It has 2 parts which join in the middle to form the central tendon, which is the insertion for diaphragm. Then that is the inferior part of this fibrous pericardium will be in direct contact with this central part of the central tendon of the diaphragm. Okay, then this fibrous pericardium is actually sensitive to pain because its innervation is coming from one nerve that supplies the diaphragm, which nerve? The phrenic nerve. Anything related to diaphragm is referred to as what? Phrenic. So because it is supplied by phrenic nerve, it is sensitive to pain. Then it is this part of the pericardium that can inflame in a condition referred to as pericarditis, in which they say that one Nigerian president died of it. Okay, then talking about the second division, which is the serous pericardium. The serous pericardium itself, it is the one that it is not as strong compared to the fibrous. It's actually divided into 2 parts. The parietal layer, which is the one that is the one that covers, that lines immediately after the fibrous one. It is sensitive to pain in the sense that it is close to it. It is close to the fibrous pericardium. Then it is supplied by which nerve? Phrenic nerve. Then talking about the next part will be the visceral part of the serous pericardium. The visceral part of the serous pericardium, it is the one that is inseparable from the heart. It is very in close relation to the heart. Therefore, serous pericardium is the one that lines the inner part of the fibrous pericardium and outer part of the heart, very in close relation to the heart. Then the next thing that we are ought to know about this parietal and viscera, since this visceral serous pericardium is in close relation to the heart, to be supplied by everything that has to do with the heart. It is supplied by everything that has to do with the heart. Talking about the the sympathetic plexus, which is the one that is supplying the heart. Talking about the vagus nerve, it as well supplies the heart. Therefore, it's going to be supplying. Therefore, it is insensitive to what? Pain. Very, very important. Viscera is insensitive to pain, while fibrous and the parietal serous pericardium is what? Sensitive to pain. That being said, then let's go back to the next one. The pericardial sinuses. This is as a result of development. Talk about the sinuses, but it's none of my business for now. So for the nerve supply for these fibrous and the parietal, since we say that they are the ones that are sensitive to pain, it will be coming from the obviously phrenic nerve. Then the phrenic nerve is a nerve from the brachial plexus, but not really from the brachial plexus. But if it is coming from there, it will be having the root value of C3 to C5. Okay, next one, we talk about the nerve supply for the viscera. For the visceral pericardium, it is the part of the heart that is insensitive to pain, which we said earlier. Its nerve supply or innervation will be coming from the sympathetic trunk and the vagus nerve, cranial nerve thing. The wandering nerve, the nerve that extends from the brain down to the GIT. Then for the arterial supply for this is very, very important. For fibrous and the serous parietal pericardium, their blood supply will be from internal thoracic artery. One, we can talk about our muscular phrenic artery, the muscular part of the phrenic artery. Then we can talk about, obviously, the descending thoracic aorta, because most of the blood vessels are directly coming from the aorta. If you don't remember anything, just say it's coming from the what? Aorta, blood supply, aorta. Then we can as well talk about the arterial supply to the viscera. Since that viscera is inseparable from the heart, therefore, its blood supply will be from the first part of the ascending thoracic aorta, which is what? Left and right coronary what? Arteries. That is just it. Okay, then for the venous drainage of the pericardium, it differs. Fibrous and the parietal, the venous blood will be drained into the azygos nerve. The azygos vein, the azygos vein, their azygos system of vein to be draining within inside. Then that is, if you don't remember any other thing, remember azygos system of what? Vein. Now talk about internal thoracic vein if you don't remember anyone. But remember azygos system of vein. Whenever I talk about fibrous and parietal, then remember as well what is it called? Internal thoracic vein. Then for the venous drainage of the viscera will be draining into what we refer to as coronary sinuses, which I said that it is developing due to inside the womb. It is developing from the womb due to embryological development. That is how it develops. But I'll talk about it in the next video. Then last but not the least is the clinical. The clinical, whenever you hear clinical, it can be something good, it can be something bad. We can say it might have pericarditis, inflammation of the viscera and the parietal pleura. It's inflammation of the fibrous and parietal pleura. The viscera is insensitive to pain, therefore it can't inflame. Then we can talk about pericardiocentesis. We can talk about many other clinical abnormality, but we are going to stop here. Inflammation of the pericardium is referred to as pericarditis, then and so on and so forth. Then remember we said that there is a potential space within the visceral and the parietal pericardium, serous pericardium. Potential space is referred to as pericardial cavity, which present within is referred to as the pericardial fluid, which is a tissue fluid that helps lubricate that helps lubricate the heart. Okay, there is another condition in which there will be roughening of the fibrous pericardium and roughening of the visceral pericardium. It is a clinical condition. Then this pericardial fluid is about 50 ml What does it do? It helps to reduce friction within the heart. So I believe you learned something today. Follow at Learn with Dera for more. Thank you very much and God bless you. See you in the next video.